When you stare at your penis, do you ever find yourself thinking to yourself, I try to eat healthily, stay active as much as I can, keep up with my roles, yet something about my erection or my sense of masculinity doesn't seem the same as it used to? Even if you have just thought about this subject once, you are not the only one who has done so. This is something that I, Dr. Qasim Mohammed, a specialist in urology and pelvic surgery, see virtually every day in the clinic, particularly in men who are between the ages of 50 and 60, men who made every effort to achieve everything they could, yet there is a factor that will remain unnoticed. They're being unaware of a silent error that is taking place in the background without their knowledge. As you watch this video, I will explain to you that your penis is not only a sexual organ, but it is also an early warning bell for your heart health, circulation, nerves, and mental condition as well. And we will count down 8 silent habits and sins that ruin penile health after 60 without you ever recognizing it, and I will explain to you at each stage what precisely happens and what you can do today to protect yourself from losing your penile health. Because habit number 1 will fundamentally alter your perspective on the expression, use it or lose it, but in a scientific and human meaning that is different from what you have heard in the past. I ask that you stay with me until the very end. And it is possible that this point may determine whether a man will live the rest of his life with self-assurance and comfort, or whether he will begin a cycle of anxiety, avoidance, and withdrawal from marital life without a discernible reason. Just try to picture this situation with me. Typically, the issue commences in a quiet manner, a weaker erection than the one you had previously with a more gradual response. On occasion, you may find that you are unable to achieve an erection in the same way that you used to. One of the things that you tell yourself is, it's okay, it's just fatigue or psychological stress, or I've gotten older. Then, what could possibly be more terrible than that? Avoiding the connection becomes a habit for you. You are afraid of failing. The level of your activity drops. Your weight continues to rise. Sugar levels or blood pressure begin to rise. Suddenly, at 60 years of age, you find yourself walking with caution, fretting about the possibility of falling, and considering the need of a cane or a wheelchair. This is not simply due to the fact that your rod is no longer as strong as it once was. Rather, the health of your entire body has begun to be damaged. Because you chose to disregard the warning indicators at an earlier stage. Because you were under the impression that this is something that comes with getting older and there is no need to discuss it. The fact, which may be a little bit uncomfortable but is life-saving, is that erectile dysfunction at the age of 50 and 60 is not merely an issue of manhood or sexual power. On the other hand, it is frequently an early warning from the heart, the blood vessels, the nerves, and the psyche as well, urging you to be careful because there is something that needs to be corrected. It is not for no reason that I am stating this. Due to the fact that I am a urologist, I encounter guys every week who come in with a problem that is associated with the penis. During the tests, we find that the men have undiagnosed high blood pressure, diabetes that is not under control, or the early stages of narrowing of the heart arteries. It is common knowledge in the field of medicine that erectile dysfunction can manifest itself as an early warning sign of cardiovascular disorders and general circulation issues. Moreover, what is the good news at the same time? That making some straightforward adjustments to your routine can help strengthen your erection while also protecting your heart and ensuring that you continue to preserve your balance, strength, and independence after the age of 60. Now that we have that out of the way, let's get into the countdown of the 8 most harmful sins and behaviors that silently injure your penis after the age of 60, and the methodical approach to safeguarding yourself. Additionally, keep in mind that you should remain with me until the very end, as secret number 1 is the most essential and is the one that is most directly related to your independence and self-confidence. Ignore the sign of the penis, which is number 8 on the list, as if they are of no significance. What's the issue? There are a lot of guys who have subtle discomfort, modest swelling, a little ulcer, or blood in their urine or sperm, as well as simply disregard it. He makes the following statements. It will go away on its own. It's just an allergy. I don't want to go to the doctor for this. Putting it simply, science. The penis is a component of both the reproductive and urinary systems of the body. In rare but significant circumstances, bladder or penile cancer may be the cause of pain, ulceration, discharge, or blood. These symptoms may also be indicative of an infection, inflammation, stone, prostate problem, or a stone problem. In many cases, these problems begin relatively minor and can be readily controlled if they are discovered at an early stage. However, if you continue to ignore them month after month out of fear or shame, they will eventually become a significant problem. The influence after 60 years. The capacity of the body to recover is diminished after the age of 60. Your ability to sleep, your mood, your mobility, and even your desire to get out and exercise can all be negatively impacted by any chronic inflammation or discomfort that is ignored. In the long run, a man may find himself in a state of silent solitude due to his dread of being examined and of exposing the sensitive area. In this state, he may repress his feelings, repress his suffering, and unintentionally lose a portion of his life. The straightforward process consists of: if you experience any kind of persistent pain, swelling, ulcer that does not heal, or blood in your urine or sperm, you should not disregard it. Take immediate action and make an appointment with a urologist as soon as you can. Change your doctor if you don't feel comfortable with the one you've been seeing for a while, but don't let the problem cause you to ignore yourself. Our job as medical professionals is to safeguard you, not to pass judgment on you. The worst thing that may happen is to ignore the signal, attempting to fix everything on your own, using ways that could potentially be harmful. And this leads us to the seventh position. Seventh on the list, attempting to fix the penis on your own in potentially harmful ways. What's the issue? Some people resort to unusual recipes in order to improve their appearance, grow their height or thickness, or both. There was intense pressure, violent pulling, homemade rings that were too tight, and online recipes that promised overnight magical results. Putting it simply, science. It is comparable to a fine sponge that is filled with blood vessels that the tissues of the penis are continual and intense pressure, or rings that are extremely tight may cause, there are some little tears in the tissues. A painful buildup of blood and fibrosis that develops over time. It is characterized by a lack of blood flow within the penis, which leads to a lack of strength in the erection. In the course of my employment, I have witnessed instances in which a man had placed a metal nut around his penis, which resulted in the organ being swollen and rendering him unable to remove it. In order to get rid of it, we had to contact the fire department armed with a specialized saw. Furthermore, another individual cut a ring out of a plastic bottle, and it became lodged in his penis, causing him to seek medical attention at the emergency hospital. It is not worth taking any of these risks. The influence after 60 years. Beginning at the age of 60, blood vessels become more sensitive, and the rate at which tissues repair slows down. Any kind of traumatic injury has the potential to leave a permanent mark on your erection and to have a long-term impact on your self-confidence. The straightforward process consists of: when attempting to enlarge the penis, you should not use any rings, household utensils, or application of severe pressure. Before you decide to use any gadget or undergo any therapy, you should meet with your physician first. In the event that you are experiencing difficulties with self-assurance in relation to the size of your penis, it is important to keep in mind that the great majority of men fall within the usual range, and the issue primarily lies in the way you see your body, rather than the organ itself. Worse than engaging in risky behavior is the question, when it comes to cleanliness, either ignoring it or exaggerating it to the point of injury. This brings us to the sixth position. Number 6. Ignoring the importance of cleanliness, or cleaning that is hurtful and aggressive. What's the issue? When it comes to cleaning underneath the foreskin, some men, particularly those who have not been circumcised, fail to remember to pull back the foreskin. Instead of using soaps with rich fragrances, some people scrub their skin violently, as if they were cleaning a piece of metal rather than sensitive skin. To put it another way, it is possible for fluids, perspiration, and dead skin cells to gather beneath the foreskin, which can foster the growth of fungus and germs. This could result in infected areas under the foreskin that are a nuisance, redness, swelling, and an odor that is not desired. In extremely rare instances, changes in the skin may conceal major issues if they are not checked. On the other hand, by vigorously scrubbing with strong soap, the natural protective layer of the skin is removed, which makes the skin more prone to microcuts, itching, and sensitivity. The influence after 60 years. It is possible that any inflammation or soreness in this region could cause the erection itself to be painful. This would cause the guy to avoid sexual activity, which would further decrease the erection. Also, if you do not pay attention early to a straightforward and uncomplicated routine, you may find it more difficult to maintain your hygiene after the age of 60 if your vision or mobility begins to decline. The straightforward process consists of, in the event that you have a foreskin, you should draw it back softly while you are washing. Wash the area with tepid water and a gentle soap, and then gently dry it. If you are unable to properly retract the foreskin, this is not a minor detail, but rather a reason to consult a urologist. Sometimes simple creams are required, and sometimes a little operation is required. Steer clear of soaps that are particularly fragrant and potent. It is not necessary to use anything more than water and gentle soap. In addition, what could possibly be more unpleasant than an annoyance? Over the course of the relationship, a moment of exhilaration leads to the occurrence of a major injury, and this leads us to the fifth position. Having sexual relations without ensuring one's own safety. In addition, without enough control or lubrication. What's the issue? Sex is something that some people indulge in without protection, with several partners, or in violent situations without taking precautions. As a result of the belief that lubricant or condoms reduce pleasure, some people choose to disregard them. Putting it simply, science. The risk of sexually transmitted diseases, which can affect the penis, prostate, testicles, and bladder, is increased when sexual activity is not performed in a safe environment. In the absence of sufficient lubrication and in conjunction with strong thrusting, a condition known as penile fracture can occur. This condition is characterized by a rupture in the fibrous sheath that surrounds the spongy tissues. The natural lubrication that many women enjoy decreases after menopause, despite the fact that they still have desire and arousal. This makes sexual activity that does not involve lubrication challenging for all persons involved. The influence after 60 years. It is possible that a severe damage to the penis or an infection that has been ignored could result in persistent pain, surgical procedures, or permanent erectile dysfunction. An individual may retreat from intimate relationships due to the fear of experiencing pain or infection. This can result in feelings of isolation and a loss of closeness with his partner, which in turn can have an impact on his mood, his ability to sleep, and his general health. The straightforward process consists of, when there is any uncertainty about your safety, always use a condom. Pick postures in which you have a sense of control and steer clear of situations that involve violent movements or sharp angles. When necessary, make use of a water-based lubricant that is appropriate. This is not a sign of weakness, but rather of wisdom and protection. For both aspects of the relationship, acute injuries are the worst kind of injuries there is. Damage that is slow and silent, caused by the heat and technology that is all about you throughout the day. Also, this is the fourth item. The fourth issue is that the testicles are subjected to high temperatures for extended periods of time. What's the issue? Sitting for extended amounts of time while wearing a laptop on your thigh, possessing your phone in your front pocket at all times, spending hours in the sauna or jacuzzi, wearing undergarments that are really tight. The temperature of the testicles is increased as a result of all of this. Putting it simply, science. It is necessary for the testicles to be located outside of the body because they require a temperature that is somewhat lower than the temperature of the body in order to successfully create sperm and to contribute to the balance of male hormones. Heat that is excessive for extended periods of time may, increase the amount of sperm while decreasing their quality. It is a factor that influences the production of testosterone. Induce a sensation of heaviness or discomfort in the individual. The influence after 60 years. You might respond by saying, "I'm not thinking about having children right now, what's the problem?" Having a persistent hormonal imbalance can have a negative impact on a person's energy levels, mood, muscle mass, and even their ability to maintain an erection. In addition, as we reach the age of 60, we require every ounce of energy and hormonal equilibrium to assist us in moving around and being independent. The straightforward process consists of the laptop should not be placed directly on your thighs. Instead, you should utilize a desk or a stand. You should avoid keeping your phone in your front pocket for extended periods of time. Avoid overindulging in hot baths, saunas, and jacuzzis. The short-term pleasure is not worth the long-term damage that might be caused by them. Select undergarments that are not too tight and are pleasant to wear. There have been instances of heat, injury, and illnesses up to this time. However, here is the actual twist. Sometimes the damage does not originate from the outside, but rather from the manner that you abuse your body while you are masturbating. Also, this is the third item. Number 3. The effects of masturbation on brain response, disruption, and violent behavior. What's the issue? The death grip is a technique that is utilized by certain males. This technique involves applying great pressure at a high speed, assuming a position that is unlike anything that can be replicated with a genuine partner. As time passes, the brain becomes accustomed to this particular pattern. Just to put it in layman's terms, the brain is capable of learning. If you consistently provide it with a single form of extremely intense stimulation, it will require the same intensity in order to experience ecstasy. As a consequence, the male has a tough time reaching climax or simply maintaining an erection when he is in a relationship with a partner, since there is not the same tremendous pressure or angle that he experiences in other relationships. He begins to have doubts about himself, saying things such, "I can't do it," and "my manhood is over," despite the fact that the issue is not with his talents, but rather with the approach, the influence after 60 years. When a person reaches the age of 60, every additional difficulty in reacting deals a fatal blow to their confidence. It is possible that the guy will retreat from the relationship, avoid touch, and dread failure, which will result in increased anxiety and a further reduction in erection performance, a loop that is unending. The straightforward process consists of reduce the amount of force and pressure you apply to yourself if you engage in masturbation. Create an environment that is as close as feasible to the natural occurrences that can occur in a close relationship. Reduce your dependency on images and clips that are highly fantastical, because reality is different, and your brain needs to learn to enjoy reality in order to function properly. Talk to your physician if you find that you are having trouble reaching climax with your partner on a consistent basis. Sometimes a minor alteration in routine and expectations can make a significant impact in the treatment of the condition. Let me clarify something very essential here. There is a quiet enemy that is more hazardous than any of the above, and it affects the arteries from head to toe as well as the penis. This is number 2 on the list. Tobacco use and a general disregard for one's lifestyle are second on the list. What's the issue? Smoking, not moving around enough, eating a diet high in carbohydrates and fats, staying up late, and being under continual stress. Every one of these issues is not something that is separate from the penis. Rather, they are disorders that affect the penis's basic job, which is to direct blood flow. Putting it simply, science. A vascular neuroendocrine mechanism is responsible for an erection. It is essential that the arteries be accessible and flexible. The nerves must be able to transfer messages in a tranquil manner. The hormones must be in a state of equilibrium. Cigarette smoking causes the arteries to become constricted and inflamed. The inability to walk around causes weight gain and increased insulin resistance. Stress chemicals that inhibit erections are elevated when constant stress is present. Once you reach the age of 60, when a man smokes, has a poor diet, and does not exercise, he frequently experiences the following health problems: erectile dysfunction that slowly develops, exhaustion with the least amount of effort, the risk of cardiovascular disease and stroke is increased, and because of the weakening of the heart and lungs, mobility becomes more difficult, necessitating assistance, and he loses the independence that he strives to maintain with all of his strength. The straightforward process consists of: you should give serious consideration to a plan to quit smoking, either with the assistance of a medical professional or a specialist program. It is a good idea to make movement a regular habit. Walking for 20 to 30 minutes on most days of the week is a good place to start. Opt for one meal every day to serve as the heart and penis plate, which consists of veggies, nutritious protein, healthy fats, and a small amount of sugar. We have arrived to the first habit of the day. The secret that explains why some men in their 70s still enjoy a comfortable, intimate life while others give up early is the secret that unites all of the aforementioned factors. The first instruction is to use it wisely, ensuring that flow, movement, and mindset are maintained. You may have encountered the expression use it or lose it in a manner that was either mocking or frightening. Now comes the most interesting part. The objective is not to coerce yourself into having sexual encounters on a regular basis. Rather, it is to ensure that you keep your movement, blood flow, and mental comfort associated with your body and your penis. Putting it simply, science. Erections refresh the oxygen in the tissues of the penis and help to preserve its flexibility, regardless of whether they occur when the individual is asleep or awake. Physical activity and exercise are known to increase blood circulation throughout the body, including the heart, brain, and penis. In order to lower the stress hormones that are responsible for preventing erections, psychological comfort, the sensation of not being judged, and open communication with the partner are all beneficial. When you reach the age of 60, what happens without you even realizing it? The amount of erections that occur naturally during the nighttime declines. There is an increase in anxiety around performance. It is possible that the man may shun the connection because he will experience a single failure, which will then develop into a persistent fear of failing. And this is where the most significant silent error lies. Once you reach the age of 60, it is possible that the tissues of the penis will begin to lose their suppleness over time if you fully halt any sexual activity, disregard the worry, and leave your body inactive. This will make it more difficult to obtain a powerful erection, even if other conditions improve. Concurrently, the sensation that it's over might result in feelings of depression and loneliness, as well as a reduction in the overall quality of one's life. A straightforward method that is based on a practical execution plan. 1. Maintaining a regular exercise routine is beneficial not only for the heart, but also for the penis. Not only is it beneficial for the heart, but it is also beneficial for the penis of the body. Activities that help increase blood flow include walking, light swimming, and stationary cycling. 2. Keep an eye on your sleep. If you find that you are not able to wake up with erections in the morning for an extended period of time, you should consult your physician. This could be an indication that requires further investigation. It is important to keep a close eye on your sleep. If you haven't had any morning erections for a considerable amount of time, speaking with your physician is a good idea because this could be an indication that requires more investigation. 3. Communicate with your partner. Instead of keeping quiet and retreating, consider having a conversation about your worries in a calm manner. It is important to communicate with your partner. Instead of remaining silent and withdrawing, talk about your problems in a calm manner. Simply lowering the amount of pressure that is placed on the outcome can increase performance. 4. Do not be afraid to seek medical assistance. There are a variety of treatment and prescription choices that, when examined by a specialized physician, can safely sustain erections. It is not a sign of weakness to seek medical assistance. There are therapeutic and pharmaceutical solutions that, when reviewed by a specialized physician, can safely sustain erections. This is not an indication of weakness, but rather of accountability on your part. 5. In the event that you do not have a partner, engaging in safe sexual activity with yourself in a moderate manner may be able to assist in sustaining blood flow and psychological comfort, provided that it does not escalate into aggression or addiction. Maintaining safe sexual activity with yourself in a gentle manner may assist preserve blood flow and psychological comfort, provided that it does not evolve into aggression or addiction. This is especially true if you do not have a partner. During this point, you might be wondering to yourself, the question is it too late? I am over 60 and possibly over 70. Have I still the ability to make things better? To respond to your question, as a physician who has worked with men of many ages, it is not too late, not at all. You might not be able to get things back to the way it was when you were in your 20s, but you can absolutely make improvements to what is currently happening, lessen the sense of discomfort and tension, and boost your self-assurance. To get you started right away, I will summarize a straightforward 4-step action plan for you. First, listen to the messages that your body is sending you. Watch what your body is telling you. Any kind of discomfort, ulcer, swelling, or blood, do not disregard it. Make an appointment with a urologist as soon as possible. 2. There is a need to put an end to the sins that are not spoken about. It is recommended that you reduce or stop smoking, steer clear of harmful instruments or rings, reduce the intensity of the killer grip, and avoid excessive use of saunas or high temperatures. 3rd, make sure that you provide your body with the things that it needs. Movement on a daily basis, eating more natural foods, drinking enough water, and getting adequate sleep are all important. These are not merely generic suggestions, rather they are actual fuel for the heart as well as the penis on their own. 4. Take the same level of care for your mental health as you do for your physical health. Take the same level of care for your mental health as you do for your physical health. Try to be less critical of yourself. Even if your body does not perform as you anticipate it to, this does not necessarily mean that your life has come to an end. If you feel that anxiety is taking control of your life, you should talk to your partner, a friend you can trust, or a mental health expert. 5. Learning should be continued. Continued learning is essential. Wisdom is the key to power. When you have a better understanding of your body, you will have less room for feelings of dread and guilt, and you will be better able to make decisions that are in your best interest. And if you felt that what I said today hit something inside of you, please put the number 1 in the comments section if you have ever had the experience of your body sending you a silent signal that you ignored, or the number 0 if you are hearing this for the very first time. The purpose of this is not to test you, but rather to determine the number of men who are going through the same experience as you are, and to give you the impression that you are not alone.